practice is done by the universities and institutions. Now, I don't know whether this is right or I'm getting it wrongly. They want now teachers to repeat teaching practice after finishing the university and diploma. I don't know what members of parliament, are you aware of that? The teaching practice. Government is, yeah, the policy has already been passed. They want now these students who are going to graduate now, instead of joining and starting to teach, they are going first of all to go under teaching practice supervised by government. You are not aware? You are aware? With about 20. If you look at the numbers that we are graduating, we are not reaching 500 students for PhD. If you look at Kenya, on the University of Nairobi, every year is graduating 500, 600 students for PhD. So my humble request would be, if government can step in, because people will not manage to pay for PhD. It has three parts. It has fees. The Deputy Secretary General, thank you for coming. My dear brother Uhuru, Salim, thank you for coming. I don't know whether others came. Tango Doi, he told me that he's coming. He's not here. Oh, but thank you for representing our other members of SEC. Thank you very much. This time round, I want to talk about the training that we are undergoing and we are going to do, especially on postgraduate. One, I will thank the management for the work done, because we've been having a gap in training the MMeds, the Masters of Medicine. At least now I am seeing the light. Today I can see we have over 50 students graduating in Masters of Medicine. This credit goes to about 5 people, because that's why I have seen improvement. It goes to the Principal College of Health Sciences, Professor Martin, and his deputy, and the Dean of the Medical School. Because I can see we've been lacking a lot of staff, especially in pediatrics. But today, I have seen you. Where is Professor Martin? Professor Martin and your deputy? Yeah, thank you very much for the work done, because I can see in your own area, this is a professor of pediatrics, and for the last 20 years, 15 years, we've been trying to reach 20 students graduating in pediatrics. And I can see with your team, I don't know the professor, because I gave you, I helped and sourced 3 people to help in supervising, who is Professor Grace Ndezi. I don't know whether she is here. I had called her. And Professor, who? Nankunda. Those 4 people, 3-4 people, they have helped us from 1 or 2 students to 15. That's a big number for pediatrics, because we've been trying to get 10 students per year in pediatrics for the last 10 years, but this is the first time to get over 10 students graduating in pediatrics. Thank you very much, Professor. Thank you. But still, I can see a gap, because when I was looking at internal medicine, still, it is still the same problem. For the last 10 years, we've been graduating 1, 2, 3 students. Even today, I have seen only 1 student graduating in internal medicine. So you need to help and put a lot of efforts on that. But so far, so good. Thank you. Then we have our Dean School of Medicine, because I have seen his numbers also in obs and gyn, and he's an obstetric. His area of specialization is obs and gyn, and I have seen we have registered a big number, over 20 students graduating with masters in obs and gyn. Thank you very much. Thank you. And this was our student. Also, I wanted to mention only that the VC has mentioned that we have 2 people graduating. Our University Secretary, Asia Mbabazi, she's our student for masters, and now she got our PhD. Congratulations. Then we have Dr. Umi. Dr. Umi, she was in our first cohort in medicine. She went to Australia, she got her masters. Now she came back and got the PhD with us. Congratulations, Umi. Now, This is because I will be mixing. Mr. Chancellor, sir, for the last, since we started this university, we've given over 15,000 scholarships to the students. Over 15,000, giving them scholarships. Some have finished, and we are embarking on a program of giving over 1,000 scholarships to Ugandans every year. However, this time round, we want also to look at postgraduate. We have, as Arua member, Kampala International University is a member of Arua. Arua got 10,000 scholarships for PhD students in 10 years. Each year, registering 1,000 students for PhD. In Uganda, Arua members, it is Chambogo, Makerere University, and KIU. So in Nairobi, we have University of Nairobi, we have Kenyatta, we have Moi. In Tanzania, we have University of Dar es Salaam, we have University of Dar es Salaam, we have Muhimbili, and we have University of Dodoma. Those are members of Arua. Arua means it is African Research Universities Alliance. So I would thank Professor Katunguka. I don't know whether he's here, Professor Katunguka, because he's the one who registered us. Because for you to enter, to become a member of Arua, you have to have 3 universities inviting you to become a member. And this time, we worked with Chambogo through Professor Katunguka, and we work with the University of Nairobi and Muhimbili. They are the ones who recommended us to become members of Arua. Now, for that matter, my dear, our visitor and chancellor, what we are doing, we are getting about 30 or 40 PhD students sponsored by Arua, but we want to double them by adding another 30. If we get 50, we shall add 50. If we get 30, we shall add 30. This program, the way it works, you will be doing here 1 year and doing another 1 year in any of the 9 universities in East Africa. Then you come back to your original university. Then you do your research for 2 years. It's a 4-year PhD program. But my proposal, which I have proposed to the management, I propose that we start with girls' child. The women who are having a master's degree from this August, we want to support them to do their PhDs up to a minimum of about 100 PhD per year. Because we have got about 100, about 85 already accredited with National Council. So we have the capacity of taking up 100 PhD students per year. So from this year of August, we shall be taking our 50 and 50 for Arua, especially for PhD students. Then for master's students, we shall be taking over 300 for master's students per year. So that's a big thing, a big move. You should clap for it. And then, of course, we shall continue to develop our staff. We are at a level of 408 PhD staff, but we want to go by 2030 to go to double the number, 2035 to go to almost 1,000 PhD staff. So that's why, for that matter, we have to train our own 100, and then we can get the rest from other universities. Then another point which I wanted to emphasize on is the infrastructure. As the VC has already mentioned, we are doing a lot of infrastructure. I think if you go behind there, you could see School of Pharmacy. I don't know whether there is any person from Pharmacy Council here, because we wanted to increase our numbers for pharmacy from the 300 accredited to 500 from next academic year. So we were advised to do the necessary adjustments from the infrastructure we had almost by double, and I think by the end of next year, we should be done with the infrastructure which the Pharmacy Council has advised us to do. We are working tooth and nail to make sure that we achieve what we were directed to do. Then number 3, I will also thank the Chancellor for the advice which he gave the management. At least now for this year, we have got over 3,500 publications. They are almost the same number because we had 3,200 publications. Now we shall have about 3,500, but at least 50% they are in high impact journals, Mr. Chancellor. So this will push us. If you look at our ranking this year, we are number 2 global, in Uganda, but we have moved almost 1,000 points from about 1,500 to 1,200 globally. And now if you look at number 3, which is our number 3, the university following us in Uganda, Mbarara, we have now, with the same publications, we have almost 350,000 public citations. When Mbarara, which is following us, it is following us with about 122,000. Almost we are 3 times. So we are number 2, but we are number 2A. I don't know whether you are getting it. Now if you look at Makerere, it was almost 450 citations. The gap when we were still at 150. Now this year it is 460. We have to do very much for this work done this year. Because we shall have what Makerere has, and having 5 times capacity in numbers of staff than what we have. I don't know whether you are getting the point. So I request the management to keep on and to make sure that this is kept on. And of course, I will thank you, Professor Ngoma, with your management, for the grants. Because at least the grants compared to last year, this year we would have doubled, but because of the US restrictions, we are almost 150% of what we got last year. So keep it up, because this is what is helping the other to help us to achieve this. Then of course, my advice to you is to use technology. And this is my appeal to the students. And also I'm requesting you, Professor, the VC and the Chancellor, also to advise more students in writing and getting grants. Students who are here, postgraduate students, those ones who are going to join us in postgraduate, I think it is important because it looks like you are not reaching out to students. We would have almost doubled the grants if you are involving, because we have over 3,000 master's students in the system, and we have over 550, 600 PhD students. If all those are writing grants, I think we would have gone very far. I'm pleading to you to ensure that you attract as many students as possible also to write, and also other institutions to write. To join us, like the municipal here, Ishaka Bushenyi municipality. Please join the university and run for the grants, because we have so many calls. I think now we have like 40,000 calls. You cannot fail to get one. But members of parliament who are here, please join. Get those women, get the disadvantaged groups, so that they can write with the university and they get free money. It is up to you, but I'm encouraging you, and I can help to allocate you some staff with the Vice Chancellor to make sure they can be of good use. And even the churches, the mosques, you can also write with the university and you get some free money to develop our community. Then of course, lastly, I am going to request the government, although the Vice Chancellor has already talked about it, but of course one, and this one is going to my friend, the first Deputy Prime Minister since you've come, and a very competent person. In fact, for me, I thought that he was the Prime Minister, but I found that he was the first Deputy Prime Minister, which is okay also, but I wish he was the Prime Minister, but God has made it like that. We thank God for that. But one of the problems that we have, Prime Minister, first Deputy Prime Minister, is medical insurance. This one I have been talking about it, but I am sure you being a doctor and with Dr. Baryomunsi also being in health, both of you are medical doctors, you will help this country to get medical insurance. Because if you look at this, the whole of this region, you look at all the 12 countries in East Africa, it is only Uganda without medical insurance. And this is putting us behind because the private sector will not put in money in the hospitals unless government has a medical insurance. So this is an urgent matter. We are already late. I'm also going to help you since I'm now a member of SEC. My colleagues, members of SEC who are here, we need to talk about it in SEC because it is a very, very big problem. If you look at Tanzania, which started insurance in 1989, now the under 5 age person, he gets free treatment because of that insurance. The above 70 and above years, they get free treatment because of that insurance. Every Tanzanian can go to any hospital and get treatment. Any Tanzanian who cannot be treated in Tanzania, he can get a recommendation and goes to India, he gets a treatment on the insurance. It's a very, very, very important point. Members of Parliament who are here, Cohen, you are not here. Please, you have gone to Parliament, you've just started your term. Get us Honorable Mawanda, leave the tuko pamoja, but get us the medical insurance such that our society can be relieved in terms of treatment. Point number 2, it is on the taxes, the chief guest. The taxes, certain things, of course, I believe that we should pay taxes as for our country, for us to go. I paid 730 million. But the internet that we are using, we have about, is it 2G? We have about 2G, but we are paying $20,000 per month for internet. In a year, we are paying 1 billion shillings paying for internet. So I think if such service, because everybody is benefiting out of it, if such a service is given benefiting out of it, if such a service is given for without tax, 40% out of the $20,000 that we are paying, doubled or gotten 150% of what the internet we have, but we couldn't do it because of the cost. I wish, because technology is part of us, we can't run away from it. I wish that can also be waived. Since you are here and we have members of Parliament, I will keep on you, and I'm a member of SEC. I think we shall take up certain issues so that they can be exempted. Then number 3 is internship. You people who are here, you can think that KIU is graduating 200 doctors, and you think that these doctors are for KIU, they are for Chancellor, but these doctors that we are training, they are for East Africans, they are for Africans, they are for the whole world. But some individuals, Mr. Prime Minister, they take it, they think that private institutions, when they train doctors or pharmacists, they are theirs. They are not ours. They are for government, they are for everybody, and they can treat everyone. So, I wanted you to go back and look at the policy they want to impose on the internship. One, they wanted to stop their pay. At first they wanted to stop it, but we went and negotiated with the president, and I'm going also to get a team. We go back and negotiate it again. Then at least it was reduced. Reducing it is okay, but they give them something. Even if they reduce it 500,000, because they were giving them 2 million shillings, they wanted to scrub it off. I went with the team, we pleaded with the president, he reduced it by 50%. Now, they want to abolish it completely, which is wrong. What I thought, if the numbers are big or they are many, but if you look at other countries, Uganda, we don't have big numbers compared to Kenya. Because Kenya internship, now, it has reached about 6,000 students in internship. With about, is it 60 million? Kenya has 60 million. Now in Uganda, we are about at 2,000. So 6,000 against 60 million, and 2,000 against 50 million is not a big number. So for me, my recommendation would be if the pay is big, they can even again reduce it to about 750, but they maintain internship. And if they feel that the quality is affected, for me, I don't have a problem. The students can do exams before internship. That is also okay. They measure which university is doing better. Also, that will help us, because at first, I want to give you a story. When we were starting law school, in fact, we are the ones who made the LDC to start the pre-entry of exam. We produced 400 students. Makerere, by then, it was producing about 200. They said now, these students of KIU, the quality might not be up to the standard of Makerere. They introduced the pre-entry exam. Now, they don't say it, but they are saying out of the 2,000 that are being taken, about 1,500 are coming from private. If you look at the LDC performance, the 20 students, about how many? They were 50? There were 56 students who got first class, not so. 56 students who got first class, but 10 were KIU. Only one university. We took there about 320 students out of the 2,000, but 10 students out of the first class were KIU students compared to other institutions. Makerere, which they were talking about, they got about 2 or 3 first class students. So for me, I don't have a problem for giving exams for the interns, because that will regulate quality. But they should not stop giving some money to the interns because they are doing a government work by treating students when they are doing the internship. So for that matter, I wanted to request you this voice. You can take it to cabinet members of parliament who are here. For me, I am for interns. Before a student go for internship, they can subject them to the exam. If you qualify, you go for internship. If you don't go for internship. That is fine. If they are saying that they are regulating quality, that is okay. Let's allow them, because in Pharmacy Council, actually Pharmacy Council has been doing pre-internship exams for the last 20 years since we started the pharmacy school. And our students are performing the best in Pharmacy Council. So I don't have a problem, Chief Guest, as a government representative here. If the students before internship, they do a vigorous exam, and you will get surprised, because government and some government officials, they are trying to protect government institutions, but they don't want to come out clearly to say so. They think they are punishing private, but let them be fair. They subject every student to exam for a pre-internship. They get students in a fair manner, like what Law Council does, like what Pharmacy Council does, then they go for internship. That is fine, but they shouldn't remove them completely from a small pay. Then lastly, of course, my request to government is postgraduate training. And even the loans board. If you look at the loans board in Uganda, the numbers that you are giving as government, or the numbers that we are giving, like last year, they gave about 1,200 or 1,500, something like that. But if you look at other countries, you look at Kenya, loans board, Kenya, they give about 10,000. We are giving about 1,000. If you look at Tanzania for them it is even worse, because they give everybody who is taking sciences So they have other weaknesses, but on loans board, Tanzania is doing much, much, much better than all these other countries. So my request, yes, if you look at the loans board, our loans board is still giving very small numbers. But for me, my proposal would be, we are getting so many universities. If you look at the PhD graduates per year in Uganda, this year Makerere graduated about 230 students. We are going to graduate about 50 because we have 13 now. We shall have about 30 in the next graduation. I think we are number 2. Mbarara will graduate about 20. Number 3 will be Chambogo, who is also about 20. Maybe Bustema is about 20. If you look at the numbers that we are graduating, we are not reaching 500 students for PhD. If you look at Kenya, only the University of Nairobi, every year is graduating 500, 600 students for PhD. So my humble request would be, if government can step in, because people will not manage to pay for PhD. It has 3 parts. It has fees, as school fees, and also it has money for research. That's why numbers are few. If you look at the numbers that we had, who were supposed to graduate in the 3rd year, 4th year, 5th year, we have about 100 students. But they could not graduate because they could not clear their fees. They could also not manage the money for research. So if government could come in and also help give postgraduate scholarships, give postgraduate loans, I think the numbers could go up, because we are still very, very low. Because now if you look at, for example, the graduates, you'll find we are graduating about out of 10,000, we are not making 5% in postgraduate. It is actually not now us who are making 10% of our total graduates, because we are supposed to have 2,500 with about 250. That's about 10% of the number. But other institutions, they are not making even 2%. So if you could help, even if you look at Makerere, they graduated about 1,000, and PhDs, all total it was about 1,200 postgraduate out of about 10,000. Still it is small. So if you could help, and loans board covers also postgraduate, that would help a lot, because most people, they don't know that the more the citizens that you have at postgraduate level and PhD level, the better citizens that you would get. Most people, they don't know, they think that you are wasting money. You first teach the undergraduate, then you teach the postgraduate. No. For me, I believe the more PhD people that you have, the more masters people that you have, the better the citizens that you will get in the country. Lastly, it is on teachers. This one I've read, actually someone has given me this, but I have already raised this to the president. We have 2 problems in teachers. I don't know whether people from National Council are here. Problem number 1 is closing the grade 3 teachers. The grade 3 teachers, the colleges which were closed. Because I think we were misled, and someone came and told government that the teachers are very many, therefore teachers can be coming for diploma and degrees. I think it was a big mistake to close the grade 3 teachers college, because they are our sources of the training from primary schools. And if you look, because for me, I don't want to disclose, but I have some shares in two of the best primary schools in the country. We had stopped taking up senior 6 and senior 4 teachers teaching those primary schools. But since they closed for the last 5 years, the teachers have started now. We don't have teachers. Even now, I'm sure some of the primaries around, in the next 5 years, they will not have teachers. Because of that level of grade 3, which was abolished. Now, they want teachers from universities, and also teachers from colleges which are offering diplomas, and they are not enough if you look at the numbers that we have. And also those teachers that used to teach us in primary schools, they are important to stay on as teachers from colleges, from S4, then they go for teachers, because now even if now you look at the numbers that we are getting, you will find that we have millions coming from senior 4, but few numbers going to A level and very few numbers going to the university. It means that we are losing a very big number after S4 who are not continuing because of abolishing of that part. Then number 2 is the internship. Teaching practice. Teaching practice. Because teaching practice is done by the universities and institutions. Now, I don't know whether this is right or I'm getting it wrongly. They want now teachers to repeat teaching practice after finishing the university and the diploma. I don't know what members of parliament, are you aware of that? The teaching practice. Government is, the policy has already been passed. They want now, these students who are going to graduate now, instead of joining and starting to teach, they are going first of all to go under teaching practice supervised by government. You are not aware? You are aware? Yeah, it has already been passed, and I think it is starting next year, because it wasn't in the budget. It is starting next year, but I think if that can be looked into, you would rather increase the number of years, because now government is also going to become a university by managing what has been managed already by higher institutions of learning. I think this was also an oversight. If you could help and take this up. Then one last thing is super special training. The medical doctors that we are training, they are stopping at master's degree, but super special training, universities might not manage because the numbers are too slim for super specialization training. For example, we have now OBS and GYN. Say you have 10 pediatricians who have finished masters. Now, out of those pediatricians, if you tell them that now we want you to go back for 3 years for pediatric surgery, you will get 3 students. It will be difficult for universities to take up that task. I would request also government for super specialization, it must come in and support the parents and the students to do those. And they are not many, because you will not have more than 500 per year enrolling for super specialization. For example, now pediatricians to do pediatric surgery, surgeons to do orthopedic surgery. That will help us, it will help our health system to grow, and we shall have a high quality health training for our people, and we shall get good results in the hospital, and our people will get better health and better care in their treatment. Thank you very much. I wanted to translate because here there are so many people from here. I think, do I need to translate? No? Okay, thank you very much. Parents, thank you very much for paying the fees for your children. Chief guest, thank you for coming. Chancellor, thank you for allowing this function to take place. May I wish everybody to go back safely, and thank you very much and all the best.